afternoon. I am nursing assistant Rihanna, and today I'll be caring for a diabetic patient. First and foremost, diabetes is a group of disease that affects the body normal range of using glucose.
Diabetes symptoms varies between patients of different age group.
Washing was performed before greeting the patient. First, we begin with the wetting of the hands. Now we're lathering the hands with soap, washing the behind of the hands, the back of the hands, washing the tip of the fingers, the thumb, both thumbs, the wrist. Now we're rinsing. Rinsing completely. Now drying. For drying, we pat dry. Pat dry complete. Good day, Miss Eccleston. I'll be on your service today. Today, I would like, before beginning this procedure, I would like to obtain some information. May I have your name, please? Just verify the spelling of your first and last name. Also, your telephone number and your date of birth. Wristband was checked for further verification. Then I proceed sanitizing. Sanitization of both hands. Drawing my privacy curtain to provide privacy for my patient. Then donning my gloves. Donning of my gloves. Miss Eccleston, how was your day? How have you been? Both gloves are done now. I proceed with getting my wet cottons. Also applying more sanitizer to the cotton. And I'm cleaning the index finger because we're going to perform RBG testing. Clean the index finger properly while I gather my further equipments. My lancet. Insert my lancet in the machine. Get my strip, also insert my strip inside the machine. After putting in the strip inside the machine, I go ahead with my procedure. Stick my patient and I collect tip of blood. Gave her the cotton to apply pressure. And the reading was normal. It was 6.5 mmol. I went to dispose of sharp hazard in the biohazard bin. Also dispose my gloves. Now I'm back. I'm going to proceed with taking the blood pressure reading. Gather my equipment once again. And when I had to sanitize the cuff and also the stethoscope. I'm applying the cuff to make sure that my patient blood pressure is normal, because it would be pretty bad for my patient to be having a high blood pressure since my patient suffer from diabetes. So I proceed inflated the cuff. Cuff was inflated to 180. Since my patient is not hypertensive or does not have an history of hypertension, the pressure reading was normal also. The reading was 110/70 mmGH. Sanitize once again because I'm going to put away my stuff, my equipments. Once again, I'm sanitizing my hand to prevent cross-contamination. And I'm donning new pair of gloves because now we're going to perform, I am going to perform oral check because it's crucial to perform an oral check, skin check for a patient who suffered from diabetes. Inside her mouth was okay, good. There was no cavity present, no form of plaque building up, nothing. I proceed with checking her skin for any form of irritation, also both arms. Also, I provided range of motion. Privacy blanket was necessary because I was going to remove the covering sheet to check her leg or thigh, and also to provide range of motion. Since my patient is bedridden, range of motion is critical, and it is necessary for nursing assistants to provide this range of motion. Whatever is done to one side will be done to the other. So both sides were checked for any forms of irritation. Range of motion was done. In between the toe was checked. Range of motion in the legs for both legs. I now went ahead to put back the draw sheet in place while I remove the privacy blanket. Went to put away the privacy blanket and put draw sheet back in place. Make sure my patient is well taken care of. And the sheet is neatly set to prevent any form of irritation. Since my patient is bedridden, I'm going to explain that I was taking my leave, dispose my gloves, and I'll be right back with my patient in a few. I went, I sanitized my hand, removed the privacy curtain. then explained to my patient that I'll be taking my leave, and for any assistant, was there anything for any assistant? But my patient was okay, so I took my leave. Though I leave my patient, I went to document my findings, the date, the time. There was no form of irritation, no form of cavity present. Bed sore, my patient was healthy. RBG reading was normal, even though she is diabetic, and her blood pressure reading was good. Not much verbal communication was seen throughout the video due to the fact that I was suffering from a flu and I did not want to put my patient at any disadvantage. Thank you.